information management director. Her work in INR began answering phones at 211 and then grew to helping in the database. And she transitioned into the database manager role and is very proud of achieving 100% update 6 years in a row. Jennifer, you've got to share your knowledge on that, and help creating help sheets, and which is a mobile app for the agency's resources. She has a master's in community counseling, a bachelor in social work, and is Inform USA certified CRS and CRS DC. Thank you so much for joining us, Jennifer, and I'll let you take it away.
Thank you for having me, Michelle and Inform Canada. It's a great pleasure to be with you all here today. And I am going to share my screen here and get us started. And just as I was preparing to be with you this afternoon, reflecting on really what a great privilege and honor it is for me to be the one here sharing this information with you. The standards have been built and evolved over many, many years with many, many smart people investing their time and heart and knowledge into helping us as an industry be the best that we can be. So I'm humbled to be here with you and hope that you can take a few things away from the presentation. All right, so as we get started, I just want to start by getting a sense of people's familiarity with the standards. So if you wouldn't mind, I would be so grateful if you could drop in the chat, where are you on this scale? We know that Inform USA members have a wide array of knowledge or experience with the standards. Some might be really on the left-hand side of this scale as I'm looking at it. There are standards, like maybe this is a new concept, maybe they're new to the field. And then we have some that are way over on the other side, that they feel like they live, work, and breathe the standards. It's their reference guide for everything they do in their organization. So I'm just curious if you wouldn't mind going ahead and dropping in the chat where you all are at on that scale, if you would be so kind. That's it. That's good, Michelle. That's over half. 7 brave souls. We had someone thank you, Mark. We had someone at the conference in Grand Rapids admit to being a 1. Actually, I think she said 0. And I applauded her bravery. It was in a room of about 100 people. But, you know, we all start somewhere. Before I became involved with at the time AIRS, I didn't know anything about the standards. So we all start from somewhere. So that is great. No matter where you are, there is an opportunity for you to move along the scale. All right. So today's objectives for this presentation are that we are going to review the process, so you have an understanding when a new edition of the standards gets published. What goes into that? How do we arrive at this new document? I think it's really helpful to have a context and an understanding of the work and intentionality that was put into developing it. I think you'll read the document differently if you have that understanding. Next, we're going to look at what I call the waterfall effect of the changes that then take place as a result of this new version of the standards being published. And lastly, we're going to look at the high-level changes. There were a number of significant high-level changes to the standards, again, that will impact how you interact with it. And so we just want to make sure that you feel comfortable with that by the end of today. And so I want to first start by kind of leveling the playing ground and perhaps providing some clarity about the standards. I think some people have some misperceptions as to what it actually contains. And so I find it helpful to think about it in the following way, that the standards in general is the what of INR and the why of INR. So why do we say that organizations should do client advocacy or have a confidentiality policy? But the how, it really comes in different ways. And you first have to keep in mind that Inform USA members really span the spectrum from small shops. I mean, we have literally INRs that have 2 staff or 1 person on the phone, to organizations that have over 100. We have some in very, very, very rural areas. We have some obviously in very urban areas. Some are 211s, some are not. And some just have, you know, a variety of local impacts that it would be virtually impossible for the standards to address each and every one of those unique situations. And so the standards are the guideposts, the guiding principles, the aspirational best practices, but they do not tell you how at your local organization, with your staff, with your resources. That's another big variation, right? Is budget, is resource. So we don't say how necessarily you at your shop would implement each and every one of these quality indicators. But I know that you are looking for those answers about how you should do these things and how you should put them in practice. And so Inform USA does have obviously some other resources for you. The INR training manual. And I don't know if you all were platinum members at the time of the last publication being released. If you were, you maybe have your free hard copy. We are very, very close to getting ready to release the next updated version of that. And so in there is really, as the name implies, training about these various topics, how to do them in your day-to-day practices. The other resource I would champion, not surprisingly, based on my title of accreditation director, but is the accreditation process. And that, for those of you who don't know, is really taking an organization's practices and evaluating them in a consultative way as to whether or not they are meeting the standards. And so the manual, the accreditation manual, is a really good tool. If you wanted to see if your organization is meeting the standards, you could take the accreditation manual and work your way through that as a process, or engage in accreditation. And you can talk to me more about that at some point down the road, if you're not already. And then again, just really at a local level, get smart people around the table and discuss how you're going to implement these. And as I've been able to attend some other sessions of Inform Canada Symposium, you know, collaboration, even in the last session, was talked about so highly. I encourage you to collaborate across organizations and reach out to your colleagues and partners and ask them, if you're struggling with something, how are they implementing this in their shop? And as I said, I just have to hit it home one more time, that who are the standards for? They are for everyone. And our membership is quite diverse in all the areas that I've mentioned before, comprehensive or specialized, small, large, been here for years or just barely getting started. And so that is a very important point that the committee kept in mind this year as we were working to evaluate the old version 9.0, we call it, to are these practices truly accessible and able to be implemented by the large variety of our membership, because we want it to speak to all, not just perhaps a smaller segment. All right, so now to talk with you about the process, like how do we get there? We have 9.0, we need to get to 10.0. What goes into that? So we review it every 3 years is our standard time frame, our cycle. And so in building up to that, we solicit people who are interested in the standards to apply to be on the committee. And I just want to put a special plug in for Canadian members that the next time we work on an edition, we would love to have your voice represented. This year's committee was led by your very own Pam Hillier, and we're so grateful for her leadership. And I know she joins me in encouraging Canadian representation. It really is a special voice that we value and desire to be part of the process going forward. And so we actually tried really hard to make sure that there was cross-representation, again, of the diversity of Inform USA members that I mentioned before, and also specifically in their knowledge of the standards. We had some who have been through this review process 4 times. So they were obviously a wealth of information, and we had several that it was their first time. And we felt that having that mix of experience, broadened the perspectives around the table and created for very worthy discussion. And next, we always, it's very important to us to get input from the field. And we do that in a few different ways. Before the process even starts, we send out a survey and we say, we are getting ready to review the standards. Please submit any input you would like the committee to consider. This year, we also had at our Orlando conference a special session where a room packed, actually standing room only, full of people broke out into different sections, the 5 sections of the standards. So if you were really into the resource database, you gathered with your colleagues and kind of dug in and wrote all this feedback. Also on Post-it notes. I mean, you can imagine me kind of trying to put together all these Post-it notes and create meaningful notes from them. But I did, and then the committee really took that input from individuals and at every stage of the process looked at what are the members saying, where do we need to clarify and refine our language. And so that was very, very important and helpful. And then again, at the end, we published the draft and submitted or solicited, member feedback at that time as well. And so throughout the process, member voice is heard and valued, and also, then leads us to that final product. Okay, so as I mentioned, there are 5 sections of the standards. And so this year we did a little bit differently. Instead of everyone being at every meeting, we broke up into 5 work groups based on those sections. Each group met at least 2 times to get through their section. Some sections are bigger than others, as you may know, and sometimes those groups had to meet up 4 times to review the content. We went literally line by line. And then we created a draft of that section and sent it back to them and got their input, and then created another draft. I don't know how many drafts we ended up creating, and I should have kept track, but it was quite a few. Then once those were semi-final drafts, we had a leadership team that put all of them together and made more edits and more passes and more drafts. Just again, trying to make it the best that it could be. And then we took a look at the supplemental materials, the glossary, the new appendix, etc. Okay, now we're going to look at the waterfall that comes. This new standards are released. Yay, everyone's excited. And the work continues. It doesn't stop there. It's really just begun in terms of informing all the other products and services of Inform USA. It certainly takes time to carry forth those changes. And so the first one on the list here is the accreditation manual, and the Accreditation Commission, which is the entity that oversees the process, has begun digging in. We take the new standards 10.0 and we say, okay, here's the old manual, here's the new standards. How do we merge the two? How do we make the old manual now reflect the updated standards? The certification exams, those are updated on a rolling basis. And so anytime a new exam is released, it will be updated for the new versions of the standards. And the training, our Learn component. The training manual has already been updated to the new content, and you will see that at its time of release. And then Learn courses. This is something I really had no idea about, honestly, back when I was working for my statewide 211, that the courses are being updated constantly. And so as the new courses get released, they are also then aligned with the new version of the standards. Okay. And so this slide here is just kind of a question and kind of a check-in. I'm wondering if anyone here has ever had any of the following thoughts when you were digging in. Like maybe thinking, I don't really understand what this standard is actually getting at. Or maybe in a certain standard, there's like 3 different things all kind of smushed together. And it's kind of hard to pick out what actually is being asked here. And then, just the questions of how does this apply to my center, or perhaps even some of the terminology. If you didn't understand what that meant. So feel free to drop in a chat if you yourself have ever had any of these questions. These are the kinds of questions that the committee wanted to have in mind when we took a pass at creating the new version. And so we felt the best way to really focus our energies and our efforts was by creating a rubric. And I'm really glad that we did. So whenever a section was reviewed, we took a look at these questions for all of the standard itself and then the quality indicators. We really tried to emphasize, is this quality indicator clear and concise? Does it have like a single focus? Is it redundant? Is this concept or this practice mentioned elsewhere in the standards? And we found that there were some of those, and it was a potential source of confusion because the language might not have fully mirrored each other. And so we wanted to reduce those and consolidate so that if a topic is talked about, there is one location with one recommendation or quality indicator about it. Obviously, all of the content in the standards, we wanted to continue the legacy of this needs to be essential to high quality INR. Not everything we do necessarily at our own shops is necessarily carried across through the industry. And so the standards at its core needs to be the true essential elements that can be implemented internationally. And then under the next one, we tried to limit the number of quality indicators to 5 to 10. Oftentimes, though, trying to keep things in its most simple and pure and concise format is actually really challenging. And so I can tell you that we didn't get an A on that part of the rubric, but you'll see why as we go on, that it's actually because of the one above it that we felt the quality indicator was important to keep because it was essential to high quality iron. Okay, so what has changed? The high level changes that I want to share with you now, again, really look at more of a formatting of the document and kind of an overall approach. And so the clarity, again, that each standard has one focus and intention, really important. We worked really hard to remove lengthy explanations. Those often we found in the sections of the standards, there were like paragraphs, really well written and interesting paragraphs, but they were more definitional in nature. And we felt that that was important to keep the standards as concise as possible, that we moved that definitional information to either the glossary or the appendix, or it is also found in some instances in the training manual. And then we also really wanted to make the language more current and have more plain language so that if this is perhaps someone's first time looking at the standards, can they understand what we're getting after, without having years of experience or insider language? Does this make sense? One very basic example of this is throughout the standards, the word inquirer was used. And while we all know that it's not a wrong name to call them, it just feels kind of antiquated. And so throughout the standards now, that term is contact or person or individual, kind of whatever the case may be, how it fits best into that sentence. All right. The next one, I have to say, is so simple. It's one of my favorite changes. And when I show you some of the actual content, you'll see why this is really important. In the past, there were quality indicators that were numbered, but then under the quality indicators, there were sometimes sub-bullets that sometimes had numbers, sometimes had check marks, sometimes just had bullets. It didn't really matter, but it made it hard if you were, let's say, trying to have a conversation with a colleague about a certain item listed. Is it like quality indicator 1, bullet number 4, checkpoint 5? Let's talk about that one. So just for kind of uniformity and having clear language, all working out of the same playbook, we use this it's simple, this decimal system, but it's just then very clear what quality indicator or sub quality indicator you're referring to. Okay, people who like cleaning out their closets, this one is for you. We did a bit of decluttering and in the previous version, number 9.0, there were 27 standards. And I actually went back and found at one point there were 28 standards and 6 sections. And so we've reduced it. We did, again, find some redundancies. And so there are now 25 standards. But the content is still there. It's just organized differently. And I think I just have to pause here and apologize. I didn't say this before, that I think that is true across the board. Like the heart of the quality and the content of the work that we do every day is still there. It's just in this version, you'll see it's organized a bit differently. And some new pieces have been added. So these are the 2 standards that were reduced: database quality assurance was actually moved under organizational effectiveness because there was a whole standard about quality assurance. And so it just is logical under there. And then disaster training and exercise really fell better under disaster preparedness. And so again, the content within those wasn't eliminated, but the having a separate standard was necessary. Okay, we also took a fresh look even at the names, the names of the standards. So standard 1 used to be information, assessment, and referral provision, but we know that a lot of centers don't call it assessment. And so it's now called information and referral and assistance provision. Another one, inclusion exclusion criteria. In fact, we heard this out of our friends in Canada that some organizations are calling it inclusion criteria or just their listing policy. And so that word exclusion is just was not necessary. So we removed that. And then this one, emergency operations and continuity of operations plan. We, again, for simplicity's sake, combine that into disaster planning. And as you'll see here in a minute, those topics are still in the standards. They're just now more clearly identifiable. All right. So this is perhaps the most visible change that you'll see is that the standards are now grouped into the segment of the staff within an INR that is responsible for the implementation. Everyone on this call knows that INR is best when everyone is playing their part to the best that they can. And so we found that in the previous version, there would be items that talk, for example, to what the agency needs to have in place. And then it might jump down to what a staff needs to do. And then it might talk to what a supervisor might need to do. And this was mixed in every single standard. And it just, when you really looked at it from that lens, it was kind of jumping back and forth. And so we just grouped them into these categories. So the organization is the top section, and within that section, there are the policies and procedures organizations should have in place. Under that are what we call the supervisors or oversight section. Special items that if you're in a training role or middle management role, you'll want to be paying attention to these. And then the last section within each standard is for the frontline staff. And so when anyone at an INR picks up the new version of the standards, there are pieces that speak to them. And I think that's really empowering how we have this new structure laid out. So it's just very, very clear. Okay, so just taking a minute here to pause. I'm going to stop sharing screen and see if there's any questions before I dig into the next section to show you the actual changes in action. So any questions, feel free to drop them in the chat before we go any farther. And if not, that is okay too. And I just have to say thank you, first of all, for being here today. Like the fact that you're, attending this session and have an interest and investment in adopting these standards, or at least learning more about them, is heartwarming and speaks so highly, of course, to everyone on the call today. All right, well, let's dig back in and take a look at some more content here. All right. So here is an example of the 9.0 version and what standard 2 client advocacy looks like. So in that kind of preamble, what we would call that, there's an overall description with some words that are bolded, and those bolded words are linked to the glossary. And that same format is still in the 10.0 version. The bolded words are linked to the glossary. And then there's just the quality indicators 1 through 4 there. And so here's the 10.0 version. You can just see that that preamble is much, much shorter, truly focused on client advocacy and the why of how we do it. And then the quality indicators, you'll see this is the first time you're seeing this here, this organizational quality indicator. That's that first subsection that I mentioned. And it's just very clearly stated, the INR service has an advocacy policy that describes, and 3 things that policy should describe. And then the next section you see here is this oversight with 1 quality indicator focused on those in middle management so that they ensure through training, monitoring, and coaching that the staff know when and how to engage and document acts of advocacy. And then this next section is the practice quality indicators. So for those frontline staff, be it paid staff or volunteers. So hopefully this gives you an idea of just those subsections and how they're broken out. Let's take a look at another one. So standard 15, this is the one I mentioned that was renamed into disaster planning. You can see now in this preamble section, there's like 3 paragraphs. This is defining the emergency operations manual, and this is the COOP plan. And again, we felt like those were definitions that are better found in the glossary. They are still linked in the new version. You'll see that here in a second. But then as you turn the page, you just have this like list of bullet points and check marks. And it's just a little bit overwhelming, honestly, to try and look and see what might I pull out of that to a fresh set of eyes. And so here's the new standard 14, disaster planning. You can see there's lots of links there for definitions. But now each quality indicator has a very clear focus. So this is about your emergency operations plan, and a link here to the appendix where there was charts or more a further explanation than just like a glossary term needed. We added those things to the appendix. This next one is now only about a business continuity plan, and this is only about mutual assistance agreement. So singular focus with links. Okay, standard 25 is a big one, quality assurance. There is a lot here. And in fact, in some ways, this kind of is last but not least. I mean, if you're trying to implement standards at your organization, quality assurance is the whole thing. It's weaved really throughout the whole standards. But this kind of calls out some things specifically. And so because there is and was so much content in this section, it's like, okay, how do we really make this digestible in a way that perhaps it wasn't in the past? And so we grouped together information in the following categories. So quality assurance processes related to an organization's service delivery are now in this kind of a subheader. So we have overall quality assurance processes, KPIs for service delivery, and KPIs for CRSs. Still within standard 25, we have now a subsection for resource database. That was that one that was redundant. We moved it over here. So it mirrors the one above it. There's overall quality assurance processes. There's KPIs for the resource database, and there's KPIs for the resource curators. And lastly, there is this other section of quality assurance and how you evaluate your community impact. as an INR. And so that is where we group together things like program evaluation, outcome measures, community feedback, and accreditation and certification. So if I could see your thumbs, I would ask for a raise of thumbs, either up, middle, or down to get a sense of your feedback of these standards thus far. As I mentioned, we did do this presentation in our Grand Rapids Grand Gathering Conference, and almost every thumb in the room was pointed upwards. The response there was very, very positive. Okay, so now the new standards, where are they? Where do I find them? On Inform USA's website under the resources tab. It's the last header there. Or you can use the short link informusa.org/standards. And I do want to take a few minutes to talk about accredited organizations, that waterfall effect, because this is often a question that comes up as a result of the new standards. So just a couple minutes here to dig in a little bit more about what this means for you. As I mentioned, the next version of the accreditation manual is being built, but it is not yet released, and it just like the standards, is going to take many months to work sufficiently through a process and then get to a point of having a final being ready to be released. We are targeting it for spring. I would love to have it sooner than that. I'd love to have it right now, but there's just a lot of work that goes into updating that document. So we thank you for your patience while we give the commissioners sufficient time to work through that. But have no fear, you can take a look at these standards and start integrating them into your practices. Break out the sections, get work groups together and start talking about what ways might we need to tweak what we are doing to bring ourselves into alignment with the new standards. The accreditation applications that come in between now and when the new manual is released will use the current version of the accreditation manual, which says 2022. But that's okay. Again, many of the items are going to be very, very, very similar. And so just wanting you to know that that is the current manual that is in place now and will be used until the new one is public. And lastly, I just want to take a moment also to acknowledge that I know in Canada, there are some systems of service delivery that are a bit unique, that we don't necessarily see in the US. Cooperative relationships in action where perhaps one entity is providing the call handling or contact handling side of INR and another organization is providing the resource database. Traditionally, accreditation had to have both housed in the same organization. And now we know that, again, as in many cases in Canada, each of those pieces are being done perhaps by different entities. And so this is an exciting new development that Inform USA has undertaken in the last year, that we are offering a kind of a new product. It's called Partnership Accreditation, where those unique entities who are, again, providing one side of INR or the other, if they are in partnership with an accredited organization, you can apply to be part of this project. And so feel free to send an email to myself, Jennifer@informusa.org, if you would like more information about that. I'm happy to have a conversation. We're excited about this new way of supporting additional organizations, digging into evaluating if they are in line with the standards and supporting them as they work to do that. So that is the end of my presentation. I will stop screen sharing so that I can take any questions as they come in. Yes, I like cleaning out the closet too. I'm a bit of a fan of decluttering. So any other questions about the standards? This session today, as I mentioned at the beginning, was more of an overview, not a real deep dive into any one standard in particular. Inform USA's training will continue to produce content on a variety of areas. Just a couple months ago, there was one about outreach, program evaluation. So these are constantly ongoing and part of our ongoing training schedule. Hello, Michelle.
Hello, Jennifer. Does anyone have a comment or a question for Jennifer? Jennifer, you and I talked before the and you did sort of just say that, you were going to talk about how these standards have been reorganized and repackaged as the, to come to 10.0, but that, it's not that you're going to tell people how to use the standards right now, that is something that people will take a look at 10.0 and discuss, if there's something they can add to their house, their shop, around these standards. And of course, I don't know, you were all there when Pam Hillier was reported as saying there's a standard for that. So,
yes.
Everything that is happening in information referral, there is a standard. And, it's, as you said, so many people over the years have contributed to this. Yeah, it's pretty amazing that we have this for our sector, and it's
it is.
Yeah.
I have found in my work that not all sectors have this. We are unique, and it is really something to be proud of. And I've heard it referenced throughout a number of your presentations throughout the symposium about how this new program or practice is, in alignment with the standards. So that's obviously great to see. It is really powerful that we have this common language that we can share. It elevates our work. And at the end of the day, I mean, it's just a privilege really to help connect people to the right help. And that's why we do what we do. So we think that these standards help do that even more so. And so it's been a privilege to be a part of it.
Absolutely. And we do have a comment here from Mark Winfield. You talked about the new partnership accreditation, and Mark is saying, is there an accreditation process currently in place for those who might only maintain a resource database and partner with a 211 service provider? Or is that just in the works at this point? So maybe you can talk a little more about that, Jennifer.
Sure. Yes. So you hit the nail on the head, Mark. That is the new products that we are kind of rolling out. It's not public yet. Like, it's not on our website. You couldn't go and find it there. So we're still calling it in the pilot phase. But again, if that is something you're interested in participating in, just send me an email. I'd be happy to talk with you. I have a program description worked up for you and a pilot application. But yes, so the scenario is if someone has a resource database and they are partnering with another entity, a contact handling center that is accredited. So again, that side, what I would call that side of INR is accredited, and you are the other side. We have now built a process to allow you to go through accreditation as the resource database. So it's really exciting. We feel like this can potentially reach some organizations who in the past, historically, accreditation wasn't really an option for them. And we know that accreditation is a source of pride and, perhaps even in some areas of funding. Some areas have it written into legislation. And so organizations want that opportunity. Some of them are like chomping at the bit. They want to do it. But this new pilot project, we are hoping creates a path for those who haven't been able to in the past. So yes, please reach out to me for more information.
That's great, Jennifer. And thank you, Mark, for asking that and for having us clarify where it's at right now. So coming soon, and anyone can follow up with Jennifer on any more details around that or when it comes out. Is there anything more?
I would just end by saying thank you for the work that you do that is standards driven, that aligns with high quality INR. On behalf of Inform USA, we value your membership and your participation in our organization, and we encourage you to become part of the standards committee next time if that's of any interest. But just know that we're here to support you, and reach out anytime that there is anything we can do to help you raise your bar on it.
Oh, thank you so much, Jennifer. And it's wonderful having you with us. That's not the case that everybody around this table right now is able to get to AIRS. So it's wonderful to have you here. And that's part of the ongoing partnership between Inform Canada and Inform USA to make sure there's a clear path of communication about what is possible and what's happening and how we can support one another in partnership. So thank you so much.
Happy to be part.
Okay. Well, I think thank you so much again, Jennifer, and thank you everybody for being here with us at the 48th Inform Canada Symposium. It's been a wonderful couple of days. We are going to, we know that there's so many amazing programs and partnerships out there. We've talked about crisis response. We've talked about the new partnership accreditation from Inform USA that's coming. We've talked about social prescribing. We've talked about data equity. We had a great presentation today from Seniors Newfoundland and Labrador, how their program has developed and evolved over the past years. And so there's so much going on in our sector, and we're so pleased that you've joined us. Look out for doing a quick survey to let us know how we did, what other pieces of information or what other programs you'd like to hear more about, what you can maybe provide to Inform Canada, maybe by considering yourself as a board member, joining the symposium committee. So thank you so much for being with us. And we thank you for just taking the time, and spread the word with your colleagues. And we'll see you, and you'll hear from us very soon again. And thank you so much. Bye-bye, everyone.